Yeah, I mean, the sickle cell is very variable, really. It's one of the striking things is some people have very few problems and other people are very severely affected or die in childhood. And one important thing is understanding why that happens and what causes that variability, because then you can, it gives you a clue as to what treatments are needed, and you can predict better what treatments are necessary and help, for example, give better information to parents and families. And the truth is there are some very big determinants of outcomes, and where you live is perhaps the most important, in that outcomes in Africa are much, much worse, say, than in high-income countries where, in most high-income countries, almost all children live to adulthood, whereas in most low-income countries, then the majority die in childhood. And again, that's not genetic, that's to do with fairly obvious things like access to healthcare and malaria and infections. And then beyond that, people have tried very hard to identify genetic factors that allow you to predict, but there are very few that are known. There are one or two, there are different types of sickle cell disease, and if you have a severe type of sickle cell disease, you do much less well than if you have a mild type. You do much, and similarly, some big factors like the presence of alpha thalassemia and high hemoglobin F levels make a difference. But the majority of other genetic factors aren't very useful as it stands.